Hey guys, welcome back to Medical Coding with Blue. It is Vlogmas Day 7. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. This year for Vlogmas, I am doing my whole series about modifiers. So I hope that you will tune in every day for the next 25 days at 6 p.m. Central Standard Time. So today's modifier is Modifier 33, Preventative Service. So I'm going to start off by reading from the CPT Professional Edition by the AMA, the Appendix A, which has the definition of some of these. And then I'm going to be reading from a really good website that I will leave the link for in the description box of this video. So here we go. Modifier 33, Preventative Services. When the primary purpose of the service is the delivery of an evidence-based service in accordance with the U.S. Preventive Services Task Force A or B rating in effect and other preventative services identified in preventative service mandates, legislative or regulatory, the service may be identified by adding modifier 33 to the procedure. For separately reported services specifically identified as preventative, the modifier should not be used. So basically, this is saying to pay attention to the language of the CPT code description. So I will get into what I mean by this in the articles that I'm going to be reading. I don't want to get too far ahead. So this comes from the California Medical Association website. It is their coding corner. And it says here, Coding Corner focuses on coding compliance and documentation issues relating specifically to physician billing. This month's tip comes from the American Academy of Professional Coders, Brad Erickson, MPC, CPC, COSC. AAPC is one of the nation's largest and most respected providers of education and professional certification to physician-based medical coders. I like the way they say that, that's nice. Modifier 33, Preventative Service, was a last-minute addition to CPT in 2011, so a little bit of history for you guys. But it continues to confuse practices providing preventative services under the Patient Protection and Affordable Care Act. Under the Affordable Care Act, payers must cover certain preventative services and immunizations, waiving the copay and deductible and paying fully for the covered services. Append modifier 33 to the code to alert the patient's payer that you provided the preventative services and cost sharing does not apply. Nearly 60 preventative services fall within the following 4 categories and are provided without cost sharing by the patient. Services rated A or B by the U.S. Preventive Services Task Force, preventative care and screenings for children, preventative care and screenings for women, and immunizations for routine use in children, adolescents, and adults. Modifier 33 is reported to commercial payers only. Watch that one, okay? And it is appended to all appropriate codes not already designated as preventative services. So again, that's going back to the language of the code in specifics. So watch. Payers are allowed to require cost sharing for services not covered under the ACA and may choose not to cover services provided out of network. Examples where appending modifier 33 to preventative services is not necessary to include HCPCS level 2 G codes such as G0103, which is a prostate cancer screening, prostate specific antigen test, and some CPT codes like 77057, which is a screening mammography. So notice the words, right? Screening that's in those. And so that's where they're telling you that modifier 33 would not apply, all right? Watch for the words screening or preventative in the code descriptions. That's where it's saying that appending 33 to those procedures would not be necessary. If you provide multiple preventative medical services to the same non-Medicare patient On the same day, append Modifier 33 to the codes describing each preventative service rendered on that day. You may also apply Modifier 33 when a preventative service must be converted to a therapeutic service. The most notable example of this, according to a CPT assistant, is screening colonoscopy. 4, 5, 3, 7, 8 colonoscopy, flexible, proximal to splenic flexure, diagnostic with or without collection of specimens by brushing or washing, with or without colon decompression, separate procedure. That results in a polypectomy. Example is 45383 colonoscopy, flexible, proximal to splenic flexure with ablation of tumor, polyps or other lesions not amenable to removal by hot biopsy forceps, bipolar cautery or snare technique. Remember to apply Modifier 33 only to commercial payers. Medicare does not accept Modifier 33. If a screening colonoscopy leads to a polyp removal for a Medicare patient, report the appropriate removal code, such as 45383, which is a colonoscopy, flexible, proximal to splenic flexure with ablation of tumor, polyp or other lesions not amenable to removal by hot biopsy forceps, bipolar cautery or snare technique, with modifier PT for colorectal cancer screening test converted to diagnostic test or other procedure rather than Modifier 33. So be careful with the Medicare patients, because again, Modifier 33 does not apply to them, because that, as far as that modifier being used for Medicare, because they do not recognize it. So be sure to follow up with the insurance companies, because Modifier 33 is only for commercial payers only. So that is something that you need to make sure that you are very familiar with. When it comes to the languages that they're talking about, look for those ones that say preventative already or screening. So on those cases, you know you're not going to apply that Modifier 33, because they already know that is a preventative service. They are talking about those codes that are preventative in nature, but they don't have that wordage in there. And so that's when, if that is what is being done for a preventative, then that's when that 33 would apply. Fun stuff, right? But it's just one of those things that as you go through and you keep practicing, this is why I tell you guys to look at the descriptions of these codes. Get yourself a coder desk reference for procedures. That is one of the best tools in your arsenal, because when you're looking at these codes and you're trying to figure out, is this a diagnostic? Is this a screening? What is this for? That coder desk reference for procedures will really help by breaking down in layman's terms what this procedure is and what it covers and what it does. So that way you will be able to fully understand what you are trying to select, and selecting the correct codes, and if a modifier applies, when it applies, and that is just going to make you a lot sharper. So make sure that you are doing that. Help yourselves. Keep reading the Appendix A. And I hope that you are continuing to enjoy this series. Please give it a thumbs up, so that way YouTube will share it out into the YouTube universe even more. Because that's what it's all about, right? Sharing this information. And if you are looking forward to those double modifiers, those double modifiers will be coming up towards the end of the series, because I really want to concentrate on describing all of the modifiers, as many of them as I can, so that way that when I start doing those combination ones, if there's something that I'm combining, there already will be a video explaining that modifier in particular. So never fear, it will come up, and that is something that I did plan on when I was planning this a couple months back. And I was like, okay, you know, modifiers would be a great 25 days Vlogmas, because what better for medical coders, right, than those modifiers. So anyway, that's my show for tonight. I hope that you have enjoyed it. Again, give it a thumbs up, like this, Share this if it helped you. If you're looking forward to a particular modifier, please let me know which one it is, and we'll get it out there. So I will see y'all on the next episode. Bye.